Before we dive in, I have some exciting news. I'm officially opening the doors for the May group of the Fertile PCOS Clinical Blueprint. I created this for the woman who is tired of the wait and see approach and is ready to actually build a real foundation for her fertility. We'll use my 3-phase plan to quiet those internal alarms and get your hormone signals working again. This exact process has a 70% success rate for pregnancy. Because I personally oversee every single case in this group, I only take a few women at a time. If you're ready to stop the guesswork and start building your foundation this May, head over to drangelapotter.com/blueprint and submit your application today. I'm looking forward to reviewing your case. Now let's get into the show. Welcome to the PCOS Lab. I'm Dr. Angela Potter. If you're tired of Band-Aid solutions and being told your labs are fine when you don't feel fine, you're in the right place. We use clinical engineering to move your body out of survival mode and into the biological safety required for motherhood. Let's get to work on your breakthrough. Hi there. I want you to take a second and just settle in with me today. Maybe grab a cup of tea, find a quiet corner, and let's just get honest for a minute about what we call a win in the world of PCOS. In the fertility space in particular, we're so often hyper-focused on this final destination, right? That positive pregnancy test. And yes, of course, that is the ultimate goal. But if we only celebrate the destination, we miss the incredible life-changing transformations that happen on the road to getting there. Success isn't just a baby. Success is the first time your period returns after 6 months of silence. Success is waking up without a migraine or noticing that the joint pain that's dragged you down for years has suddenly vanished. Success is finally feeling like you're in a partnership with your body instead of a war against it. Today, you're going to hear from Abbie. Abbie's story, it's a raw look at what it feels like to be told to just Google it by your doctor, to be pressured into medications that don't feel right for your gut, and to feel lost in this noise of the industry. But more importantly, it's a story about what happens when you finally stop the guessing and start opening the doors to your own biology. Abbie's period, it had been missing for months. She felt lethargic, she was dealing with chronic pain, and she felt this disconnect from her own skin. So listen in as she shares the exact moment the light bulb started going off, and how she moved from doom and gloom to a place of absolute confidence and connection. Here's my conversation with Abbie. Abbie, hi, I'm so happy you could join me today. Can you share what was it that you were most frustrated with, or what were you struggling with, and for how long before working with me?
I would say I was struggling for about a couple of years. I tried to conceive for about a year because that's what my gynecologist had said, to try for a year before coming back, and then she would go to the next step. So I did that, and I didn't really have much guidance on what to look for, signs, things like that. So I was just kind of trying, as everyone might do. And I was in the dark. Basically, I kind of felt like I was in the dark. And this whole year had passed. And so that's when I started looking for other programs that would be able to help me specifically. And after a year, actually, that's when I was diagnosed with PCOS. And that just really blew me away because I was, trying for a whole year, and then I get this diagnosis. And then my options were, well, since you're trying to get pregnant, they told me you can try Letrozole or Clomid. And I didn't know what those were. And I asked the doctor what they were, and she said, "Oh, well, it's on Google. You can look on Google." I had gone to a fertility institute, and she explained more and told me, "Oh, what you need to do is actually reduce the amount of carbs that you're eating." And she said maybe lose some weight. And I was just really confused because even after trying all of those things, it was not helping. And it was becoming a longer and longer time span when I wasn't getting a period, when I was under so much more stress emotionally because not, I was doing the things, but not getting the results.
Yeah. And you hadn't had a period in a long time, right? Months.
Oh, yeah. Yeah,
Yeah.
I had like 60-day cycles and then it turned into 160-day cycles. And so it was probably every 6 to 9 months that I would see a period. And it wasn't like a full on period that I usually get. So that's what was really freaking me out. I was really scared.
Hmm.
And I just thought that I needed to go through time and let time pass to go to the next step. But it really felt debilitating to like let time pass and just kind of still be in the dark about things. And then going on Google and seeing all of this information that was very misleading and very scary. And so I would not suggest that to anyone to use Google as a guide. There's a lot of information. It's just not individualized. And I feel like everyone has their very own unique situation that would need more guidance, more light shed on that path to really see clearly what to do. And so, yeah, I thought I had HA, hypothalamic amenorrhea. I thought I had that. So I had started eating a lot more than what I usually do. And that was a real blow to my self esteem because I am really into health and fitness. I thought that, in my 20s, I was doing great, focusing on my health. And what happened was I found and I believe that I was influenced by the fitness industry that is very extreme and it does not focus on fertility. So now that I was focusing on fertility and a body for fertility, it was different. And I needed to shift a lot of things, not only food habits, but mindset habits. And so I gained about 30 pounds and I felt terrible and I didn't feel beautiful anymore. And I couldn't really, fit into my clothes. I had to buy new clothes and I was doing everything that I was told to do. But unfortunately, I wasn't really using the guidance of a doctor. It was a health practitioner. It was a person trained in nutrition, integrative nutrition, and they had this whole team to guide women going through HA. But when I was diagnosed with PCOS, they had told me to continue on their program, which I probably should have really dived more into the PCOS path. But I did what I did. I tried for 3 to 6 months and my period wasn't coming back. I was told it would come back after 3 months at least. And then I was getting less and less support because they didn't know what to do. I didn't know what to do. And so I had to go on. And that's when I found you. So that was almost a year later that I had found you and your YouTube videos and your website. Every kind of situation you explained really resonated with me because I was also told that letrozole would be the good result or that carbs or just kind of these simple directions that were not very clear, not very really shedding light on everything that I really needed to focus on, which was mindset, right? Part of it is mindset. And I think that was the biggest benefit that I got from your program. And so I was so happy that, one of your first protocols is wake up and really pay attention to like my shoulders and my body and pay attention to what am I thinking about and clear my mind and make my bed and be purposeful. And so I really love that part of the program because it really shifted my focus to not go down this spiral of, oh my God, I'm not fertile, like I'm not going to be able to have a baby, and all of these fears that kind of come up that really prevent progress.
Yeah. And can you share more about how that was affecting you when you were just being told letrozole is what you can do since you have PCOS and being told, well, if you don't know what it is, go Google it. Like, how was that affect? And then having all these super long periods.
Right. And so when I was told letrozole was an option, I did a lot of research, and there's not a lot available online that, a lot of information that can trust. But I was really being influenced by a lot of other women who were saying, yeah, letrozole works. Letrozole is great. I had a baby with letrozole. And then there were other stories about side effects of letrozole and blood clots and um, not being successful in conceiving. And so I really felt let down. I thought that a gynecologist was someone who was a specialist in fertility, but it turns out that maybe their training is something a little bit different, right? I didn't want to be given a pill, basically. I felt that that was the easy way. I felt that that was the easy way. And my personal belief is that the easy way is not always going to lead to the best results. And so after doing the research, I said, I had an instinct. I want to protect my body. I want to be in touch with my body. I don't want to force my body to do anything that it can't. And, I was always open to adoption. I used to be a foster parent. And so I love kids. I'm a teacher. And I knew that this would take time. And so I knew that that was an option for me and that maybe it was successful, but I knew that it just wasn't what I wanted for me. And so that's when I started to seek out other answers, and I found many things online, but I actually found you through Roseanne Austin, who was a really great podcast, and she's really motivating and changing mindset as well. And so, yeah, that was, I think, just feeling a little bit lost, and like the easy way out was not for me, basically, in my opinion.
Yeah. I mean, that's what you were feeling in your body. Yeah.
I wanted that to be last resort for me.
Yeah. And I could see that because at that time, you like still weren't getting your period. You didn't know what first you had been told you had HA and then it was PCOS. And it seemed like there was a lot of back and forth in that time. And so, yeah, of course, you probably would want a little bit more information first. So then, Abbie, what changed for you while you were working with me?
Immediately, I would say what changed was the amount of clarity that I was receiving. And so working with you really laid everything out in these clear steps, and everything wasn't kind of thrown at once. It was like, here's this is a possibility, here's a video, and here's a program. And I printed these programs. I was able to read about it. I was able to look up words I didn't know or ask you questions anytime I needed it. And then at the same time, I was able to take action. And so I believe that those two together, taking action, taking the prenatals and taking the blood tests, those simple little things, along with taking in information that was really giving me a clear path, it was such a big boost. It was a very big boost to, my need to take in information, and also my body and my confidence. And so learning about fertility was just really, it was just fun. It became very fun with your program because on Google or anything that's a little bit more random, it could be scary because we get all of this information that may not apply. So you had tailored that information beautifully to really guide not only my actions, but also my mind and where my mind was going with this whole fertility journey. So thank you.
Thank you for sharing that. And what changes were you seeing in your body and with your hormones?
Oh my gosh. After the elimination of foods that I had no idea were affecting me. So that was a huge difference. In other programs, it was like eat as much as you can. And then in this program, it said, actually, this might be causing inflammation. And it was very specific and it was very encouraging and it was doable. And so I went through that for the first month or so and I saw results so quickly. I lost my joint pain. I felt less lethargic and more energetic. And I felt I lost, I didn't have headaches anymore. So I felt free of the migraines and headaches. And my back rash that I had had for many, many years, I thought it was just back knee and that it was going to be there forever. And it went away. The red spots went away. And I was like, oh my God, wow. So I stopped eating the things that were causing those things. So I literally was able to find out this specific food is causing this in my body. And that was my first like light bulb. And I think my first appreciation from my body telling me, actually eat this instead of this, because this food, I think it was unfermented dairy. Now I drink goat's milk and I love it. And I can still eat cheese and I can still eat, I thought cheese was the culprit the whole time, but it was just unfermented processed dairy, highly processed dairy. And so, and other things too. I think caffeine, alcohol, they were really dehydrating. And so I lowered the intake on those a lot. And so all of those things really helped me to have a huge confidence boost in how I felt, and feeling less inflammation, less joint pain, less migraines helped me really see that this is what my body needed. And no matter how much my body looked overweight or how much I didn't look like that fitness model on the internet, I felt great in my body. And I felt like I can do the rest of their program with more success.
I get so excited even now because that happened a couple months ago when that joint pain went away and your headaches went away. But it's still so exciting because, I mean, those are huge symptoms that were kind of dragging you down on a daily basis, right?
Mhm.
And to see that shift.
It feels good to, for some people, it feels good to take a pill. And I take pills too for certain things and I take supplements now, but it feels good because of that control. And I have that thing to need control or to need clarity. But this was so different that it was like, wow, I do have control now, not just by taking supplements, but by listening to looking at my reactions of my body and how it was reacting to the different foods, to really focusing on what types of foods I was eating and how much rest I was getting and what I was doing to detox and things like that. So all of those things were like, those were giving me that kind of that, I guess, I don't know what you would call it, but it just that reassurance of not that I was like in full control, but that reassurance that something good was going to result from those little changes.
Yeah, and it's one thing to read some information and then take a supplement based on that, but it's another thing when it's literally your own body telling you, "Oh, this is what I like," or "This is what I don't like." It's just a whole different way of understanding what's going on, right?
Oh, yeah. And it was amazing the way that you read blood tests compared to what my gynecologist had done with the blood tests. So, we can have the same blood test and read them completely differently. And you read them and you said, these are the supplements that you need. Unfortunately, I suppose the gynecologist was not into giving supplements or prescribing supplements. And I suppose that's just a difference in practice. But I really felt like, wow, so I'm taking vitamin D. And this is why I need vitamin D, because it helps the
Mm.
ovaries, it helps the thyroid, it helps. So that's what you were able to do when I would not have been able to find that information on Google. I would not have been able to really talk to anyone else about it because you were the specialist in PCOS. So that's what really helped me feel like, wow, this is literally specifically for my diagnosis and for my specific levels in my blood. So that's what was really amazing too, that I really loved about your work with me.
Cool. So it was like PCOS specific, but also that next level of like, but this is specifically for Abbie, like what's coming
Mhm,
up
mhm.
in the PCOS diagnosis.
Yes.
Yeah. So then through all that, what we were working on, what changes did you see with your cycles?
So, wow, I did have, let's see, when my first period came, I was just so excited and so happy. And then I had 2 short cycles. So I had another period after a couple weeks and another period after a couple of weeks. And then um I started taking melatonin consistently, and then that's when my cycles were full, 28 to 30 days. Those, I think, just going through each phase and seeing, like, my body kind of clearing up from I had old menstrual blood, and I had to kind of go through this detoxing period that so it wasn't totally discouraging to see, oh, I have short cycles. It was like, actually, this is a good thing. This is the next step that your body is now releasing now that it can and it has. Your body, I was able to believe that my body was able to feel good about now having a menstrual cycle, now being able to release. And it was just this beautiful, like, letting go period of like, now my body feels safe and it feels nurtured and it feels good to be able to start the cycle again. So I'm giving it that time.
Those are some really beautiful words that you used to describe that. I love that. Yeah. And so earlier you were mentioning that when you were diagnosed with PCOS, you were basically just told, okay, you can try this medication, but you really wanted to know more about your body and not just take a pill to cover things up. How are you feeling now in that sense versus when you were feeling that?
So now, as in, how am I feeling based on what's the progress that I've been going through?
Yeah, sorry, like, back then you were just being told, okay, the only answer is letrozole, but
Oh,
you were feeling like there's got to be something else. So now that you've been through this experience and you've seen your body shifting, how are you feeling about those possibilities of what's available for your body?
well, first of all, I am so glad that I went with my gut and went with my intuition, my instinct, whatever you would like to call it. And I feel a lot of women have this that when they're given something and they feel bad about taking it, that's what I didn't want to do. I would do anything to have a baby, but I knew that I wanted to do it in a way that would help me feel good so that my body can feel good and my baby can feel good. And so taking the letrozole was going to feel bad for me. And so I had to look for something else. And now that search is over because now I have this path that's been laid out. And I know that if I drink some regular milk or if I eat something like raw tomatoes that are uncooked, I know that that's going to be why I have my maybe some joint pain or maybe a headache. I know that that's going to be why. And I can go back to the path of what makes me feel good. So I feel like that's the biggest difference. Like, I know the path that's going to help me and my body feel good about progressing and about regaining my fertility. I wasn't sure with the other path of letrozole and trying these different things. It was very arbitrary to me, and I wouldn't have had that confidence to know, like, okay, well, what next and what next? And it would have felt bad to depend on as someone who didn't have all of the answers to help me and my body feel confident. That was another thing.
Mm.
Confidence helps me to feel good personally. So that was the biggest difference. On this path with I'm taking my prenatals and taking my vitamin D. I am eating as clean as I possibly can, reducing inflammation in my body. I know exactly what I need now, and I am able to feel like every step and every bite that I take is nourishing my body and leading to higher progesterone levels and leading to more consistent cycles. And so I think that's like the biggest difference with the other path. It's more of like, well, what do I do next? What do I do next? What do I do next? What's going to happen? Am I going to get these side effects? And it was a little bit more cloudy, but I don't have to do that. And I'm so grateful for that. Like, I don't have to do that unless I wanted to, right? And I could probably do it with more success because I am more nutritionally, my body is more nutritionally at the levels that they need to be than they were before. And see, I didn't know that before. So that's the huge difference. Like you have been able to tell me like these are your exact levels. This is the exact type of PCOS that you have. And that's what was I can be honest, it was a little overwhelming because it's a lot of information at once, like to know a lot of diagnosis, I guess you could say, because there are 4 types of PCOS. But it was like, okay, I can grab my tools now and walk up that mountain because there is a way. There is a way to get my period back. There is a way to increase my progesterone levels. There is a way to get enough sleep to do the things I need to do to be able to conceive naturally. That was my biggest vision that I still have and that I can now have and hold with greater determination and confidence. And because I'm following my intuition, I'm following what makes me feel good in my body. I think that's like, to me, that's just the most important thing of all, just to be able to feel good while doing it. And that's what you create. You create that path. So thank you. I love thanking you so much because it's just it's like literally opening the doors to how women can be free of that. There's that, cycle that we can kind of get ourselves into of the doom and gloom and the worry and the depression. And I was in that cycle of fear and depression. And oh my gosh, I thought that I would need to start putting shots of progesterone in my body or things that they tell you at the fertility clinic. Getting these, to me, they're a little more invasive, right? Getting these tests to see if my fallopian tubes were clear. And I didn't think that I needed that. But when someone who is, has higher education and who's experienced and they say, you need to go through these steps because this is what we do. It's like, what other way is there? And turns out there are women and doctors like you who are out there to give that second option. So I just appreciate your work so, so, so much. I feel like
Thank
my
you.
heart's fluttering.
Oh, thank you so much for sharing that. When Abby, when you're thinking about this experience of working with me and these changes that you saw in your body, like what all are you grateful for this time?
Oh my, a lot. But let's see if I can summarize it. I am grateful for that clear path. I am so grateful for that clear path, for the detailed guidance, for the specialization in PCOS, the information and the guides. I've printed them all and I'm glad I'm still connected on the platform and I can go back and really see that okay, this is what I need to do more consistently, or this is maybe I can ask if I can tweak this and be able to really have that guidance in my life. And but also at the same time not completely depend on you, right? Like no
Mm.
one wants to be completely dependent on someone else. They want to be able to do it on their own. So that platform really teaches me how to be more consistent and and how to take the supplements, how to do different exercises that I can do to help blood circulation, how to detox, how to even detox my house. And so it's very it is so worth it. And it's very just it creates light. It creates so much light on the path and on this journey of fertility, which is what, oh my gosh, which is what I needed so much to have more clarity out of everything. I'm so grateful for the clarity.
That's just so special for you to hear because I remember how confused you were. Like right when we first were, that first conversation we had, you're like, well, I've been told this. And then I was in the program for HA and that didn't feel good on my body. And it just, and you wanted to see these changes, like your period to come
Yeah.
back and just feeling, lost at that time. And so how cool that now, like you have that clarity and you understand what your body needs. It's really special.
Yes, to me, that clarity is priceless, honestly. Being able to follow my intuition, my instinct, and being able to like talk with my body, feel my body, being able to be so much more confident now, even though, I went from 120 pounds to 160 pounds. Now I'm at 150 and I I can go out and be completely proud of who I am as a woman and be completely sure of what I'm eating and be loved by my wonderful fiance and family and people who don't really believe that looks matter as much, right? As much as
Mm.
health. So it's very hard in this society, I think, to kind of battle against that sometimes when we go down different journeys. But I'm so glad because the other option, the Letrozole, it would have been completely free, right? Paid by my insurance.
Mm.
I hope that that's something that will change in the future, that we can support all types of practices towards health because women really need this. Women really need more clarity in their diagnosis. And with PCOS being so much more common, we definitely need all the help we can get.
Mm.
So,
Yeah, and I love that you're really talking about how there is so much more available than just the letrozole. And it's that, letrozole works for some women and it might feel like a good next step.
oh yeah.
And that's great, but when it doesn't, and just feeling like, well, what else is there? Because all the providers I'm seeing are telling me it's the only option. And so knowing that there's other things available.
Yes, yes, that was the thing. It was either that or Clomid, and I said,
Hmm.
wait a second. And I have nothing against surgery or regular practice in the hospital health field, but once again, it didn't feel good in my body, and so I needed to stick with that feeling, and that feeling, following that feeling, led me to this work with you, which had
Mm.
oh my gosh, balancing my hormones is priceless. Balancing my mind and my body and allowing them to once again connect. And I believe we are cyclical beings, right? Like women are so cyclical. We're not we're not made to work 24/7 for every day of the week like men can do because of their hormones. I may be traditional in that sense, but I'm so happy that I'm able to really feel now. Oh, I can feel now when my period's coming. I can feel now how good it feels to have progesterone in my body, and I can feel so much more better. And I just love it. That's what I'm grateful for. Like having that connection with my body again. That I think that's something that's people overlook and they forget about. And we're not here to I believe that we're not here to control our bodies. We're here to connect with our bodies. And so Yeah.
I love that. And so, Abby, what would you say to the person who's listening to this who feels disconnected or feels like, okay, I'm being given these options that just don't feel right for my body, but I don't know what to do? What would you speak to that person?
Right. I mean, I was definitely in that situation, and I would say keep searching, keep looking, keep going with that gut instinct to find other options that would fit them, that would help them to feel good, to help them feel like a whole person again. That is so important. And that I feel like that's what's going to lead to the best results possible for everyone, and especially, um,
Well, Abby, I would be giving you a big hug right now if we were in the same
Thanks.
room. Thank you so much for sharing your story and being open because your words are going to have this ripple effect. And there are going to be so many out there who are currently feeling like you were months ago and are looking for other answers. So thank you for sharing just the rawness and the real story behind what you've been experiencing and this transformation you've had. So thank you.
Thank you. It was such a privilege and honor to be here talking with you. And thank you so much.
I hope you felt that shift in Abby's voice as she talked about the beautiful letting go her body experienced when she finally felt safe enough to have a cycle again. And I love that she used the word safety. In my work, I talk about biological safety, and you've heard me talk about it here on this podcast. And this is an excellent example of someone switching that green light into biological safety. Looking at Abby's story, she didn't just get a period. She communicated to her body that the environment was finally stable. She cleared the headaches, she cleared the inflammation, and by building that foundation of biological safety, her body was finally free to be the cyclical being it was designed to be. She regained her connection to herself and built a health profile that makes her feel proud of exactly who she is. That is what biological safety is about. And if you're listening to this and you feel like Abbie did at the beginning, feeling like you're in the dark, wondering why the standard diet and exercise advice is only adding more stress to your system, I want you to know that there is a second option. You don't have to depend on Google, and you don't have to force your body into protocols that feel like a bad fit. If you're ready to find your own missing pieces and finally provide your body with the biological safety that it needs to thrive, I'd love to help you. And if you're ready, I invite you to book a PCOS fertility audit with me. You and I will sit down together. In this audit, I'll look at your labs. I'll help you understand what has been this missing link for you that's kept your body from turning on the green light for regular cycles and fertility. You can find the link to book that audit in the show notes or visit my website. Remember, your body isn't broken. It is just waiting for you to create the safety it needs to listen. Thanks so much for being here today. I'll see you in the next episode. Thank you for spending this time with me today. If today's episode resonated with you, it's likely because you're tired of guessing and ready for a blueprint. Remember, your body isn't failing you, it's just waiting for the right signals. My mission is to help you send those signals through clinical engineering so you can move from survival to safety and finally to motherhood. To start sending those signals today, head over to drangelapotter.com/start. There you can take the Why Am I Not Ovulating discovery quiz. In just 2 minutes, you'll identify which metabolic alarms are keeping your fertility emergency brakes on. And if you're ready to stop researching and start your breakthrough, you can also book your PCOS fertility audit on that same page. This is a private 30-minute clinical deep dive with me to determine if the blueprint is the right roadmap for your fertility journey. I'm Dr. Angela Potter. Your body is capable, your health is manageable, and your future is waiting. I'll see you in the next episode.